We're often referred to as the doctor's doctor.
Dr. Douglas Lynch is a hematopathologist for Sanford Medical in Sioux Falls, and his job is to do the tedious work of finding cancer cells or disorders in the blood.
I specialize in diagnosing things like leukemia, lymphoma, and other blood disorders, helping figure out why somebody's anemic or why their platelets might be low. So I spend a lot of my time looking at blood smears, bone marrow smears, and lymph nodes under the microscope.
Dr. Lynch says blood cancer comes in a wide variety, from patients not knowing they have a blood cancer to a type of leukemia.
They may be tired or fatigued, they may have infections, and then they do a blood smear, and their counts may be low, and we may not know that they have a blood cancer until we do a bone marrow biopsy and aspirate.
He says when patients feel fatigued, they get their blood drawn, and their blood is sent to the lab.
So it'll start in the lab, and my lab techs will run the sample through the instrument, get me the results. So we'll look at the hemoglobin, the platelet counts, those different things.
The lab then sends a blood smear for Dr. Lynch to look at.
I evaluate the morphology, which is basically what do the cells look like? Do they look normal? Are there enough of them there? And then I can look at that, and then I can help direct what needs to occur next.
If it is cancer, he tells the doctor the patient needs to report to oncology, hence the doctor's doctor.
And then once we make that diagnosis, that patient then usually goes over to oncology. And then oncology is the one that's going to specialize in treating that diagnosis. In pathology, we don't really see patients.
Dr. Lynch says they know how important a correct diagnosis is for the patient.
Like I said, we don't see patients, but every case that comes through our department we realize is a unique individual person, and we want to take care of that specimen, make sure the appropriate thing gets done, and they get the appropriate diagnosis, because their care really all hinges on that diagnosis.